Welcome to Veterinary Vertex. I'm Editor-in-Chief Lisa Fortier, and I'm joined by Associate Editor Sarah Wright. Today we have Sarah Stark joining us. Sarah, thank you so much for being here with us today and sharing some evidence on some rehab and other things that I'm keenly interested in.
Yeah, thanks so much for having me. I'm excited to talk with you guys.
All right, let's dive right in. So, Sarah, your JAVMA article discusses how exposed digits increase weight bearing and alter sub-bandage pressures in dogs with forelimb splints. Please share with our listeners the background on this article.
Yeah, so I'm actually a fourth-year veterinary student at the University of Minnesota, and this study was conceptualized and designed by my mentor, Dr. Wanda Gordon-Evans, who's one of the surgery faculty here. And the idea came from just kind of clinical experience and seeing how there seem to be two groups of people when it comes to putting splints on and the distal extent of the splint. Some people choose to end the splint just proximally to the end of really to the ends of digits 3 and 4. And that's to allow for monitoring of the digits for swelling. Obviously, we don't want that. And then there's a different group of people that extend the splint a little farther and fully encompass the digits with the splint. So it's the distal extent of the splint is past the distal end of the digits. And that's to encourage the animal to weight bear on the splint itself. You can still monitor the digits for swelling when it's like that. You can kind of observe the toenails for lateral spread to see that's indicative of swelling of the toes, or palpate them, or kind of look into the end of the bandage. So it's like a little less obvious, but it's still totally possible to monitor them well. And then, she just kind of wanted to know, is there a difference in these splint types for the patient? And so what we did was take 10 university employee-owned dogs and apply each of these splint types to the same forelimb. And we used sub-bandage pressure sensors and a force platform to record how much weight they're bearing on the limb itself, as well as to see if there's any differences in sub-bandage pressure distribution between the two splint types. And similarly, actually, in the literature, there's kind of a group of people that say leave the toes past the end of the splint, and some people say leave the toes inside the splint, and some people don't say at all. So it's really, kind of an interesting thing to look at, because it doesn't seem like people have really investigated that before, if there's an impact to splint length. And so what we found was that in the toes out bandage, so where the toes are slightly past the end of the splint, there was an increase, a significant increase in pressure along those exposed digits, versus with the toes in bandage. There was kind of a more even spread and even pressure distribution. And also we found with the toes out bandage that the dogs actually bear significantly more weight on the splinted limb overall than they do with a toes in splint. So definitely there's some, interesting clinical relevance there. If you're considering fracture healing and Wolff's Law, we don't want too much force going through a fractured limb. That can delay healing. And so, it's just kind of something to be considering in practice that I think that we kind of haven't really talked about before. Is we should be thinking about that when we're applying bandages.
A really great topic, really clinically applicable. And there's actually two things that come to mind too when I hear you talking about this. First is, since you are a veterinary student, did you know that you're eligible for our journal awards?
No, I had no idea.
So we have journal awards for student, intern, and resident authors of manuscripts submitted to JAMFA and AJBR. So I'll send you the instructions after this, but you would qualify. So that's
Awesome.
exciting. And you can self-nominate too. It's really informal process, so nothing too stressful about it, which is nice.
That's cool. That sounds like fun.
And secondly is, I think this also would be a great topic for our technical tutorial videos. Did you know that we also have video manuscripts?
No, I didn't know that either.
Yeah, also all
Diddly me bit, Sarah.
Go,
Sarah.
I was like listening to you talk, and I'm like, these would be perfect. But if you want to submit a video showing just how to even like do a splint on a dog and cat, like I think that would be excellent. Because a lot of times in like vet school, you might not have a case where you get to do that, or you're just doing it on like, like a cadaver limb and not get to actually do it in the live patient. So I think that'd be a really excellent teaching video. And I'll send you more information. Let's get to a podcast about how to submit and what we're looking for in those.
Sure. Yeah.
While Sarah's plugging, the difference between our video manuscripts, as she said, and like a YouTube video is these will go through peer review and they get a DOI, document identifier number. They are manuscripts, so you get academic credit for them as well.
Cool.
Yeah,
That's
they're
interesting. I like
really
that.
cool for just starting veterinarians that might be taking on new responsibilities in their roles. And maybe as Sarah said, Sarah, right. maybe the student didn't get to do that, or even see it depending on the caseload.
Sure. Yeah, and definitely like part of our thought process when doing this paper was like, this is super relevant for everybody. Like, we didn't want to submit it to a surgery specific journal because we're like, this is for everyone, like all across the board. Everybody has to put bandages and splints on, and it's relevant for everyone, not just specialists, certainly.
Yeah, very much so. A really elegant study too. I love, these are my favorite types of studies and manuscripts where somebody says, I wonder about that.
Yeah.
And then, it doesn't take a bunch of molecular diagnostics or any of that sort of stuff. And you're making it, you move the needle as a vet student. That's pretty cool.
Yeah, it was, she Wanda has this like huge list of like study ideas. She's just one of those people that's always brainstorming and helping house officers do projects. And so she sat down and was scrolling through her list, and I was like, I like that one. That's straightforward. It's simple. I like the idea. It seems so relevant. So
Yeah,
I was
it's
pleased about it.
funny you say that. I was still am partly at Cornell, but for 30 some years as an equine surgeon, and the amazing study questions, and I just kept a rolling list of them.
Yeah.
Same thing when and students would say, is that true? Do we know that that's true? And you're like, I don't know.
Yeah.
We just, then you have to go back and dig in the literature. Has somebody done that before? Because maybe you just didn't read it. But yeah, those are the best studies. Very rewarding.
Yeah, definitely. It's been fun. It was a good one.
As a student now, are you interested in pursuing surgery, or what are your next steps?
Yeah, that's my love. I
Good.
I actually am a CVT. I've been one for 9 years, and I worked here at the University of Minnesota Teaching Hospital in surgery for 5 years before the surgeons harassed me enough that I decided I should finally just pull the trigger and go to vet school. So, um, I've always been drawn to it since like tech school, and that has been my plan the whole time. When I decided I was going to go to vet school, I was like, I have to do a surgery residency. Like, that's the plan. So we're getting there.
Very good. Well, veterinary technicians are obviously critical to our profession as well. So
Yeah, and it's I think it'll really like serve me well. It certainly served me well in vet school itself, like having the clinical relevance and being, especially having worked in a teaching setting for a long time, like I've just listened in on rounds for years and had the opportunity to absorb some of that information along the way. Or like in this case with bandages, how many bandage changes have I been present for? Like hundreds and hundreds. So it definitely has helped a lot, and I think it'll help in my career as well, just having been in the shoes of support staff.
absolutely. And knowing how you could leverage your support staff and how to appreciate them and promote them so they don't feel like technicians or
Yeah.
Yeah. You'll be
Exactly.
fabulous. Every time, Sarah, when we do a study, and maybe the whole finding was surprising to you, but we find results that maybe sort of predicted, but there's always something that's surprising. What surprised you from the findings of this article?
Yeah, so we hypothesized that there wouldn't be a difference in weight bearing between the two splint types. And there was actually a difference. There's a very statistically significant difference. in weight bearing between the toes in splint and the toes out splint, with the dogs bearing more weight when their toes were out. So that was surprising, but also it kind of reinforced the fact that it seems like the dogs, when we're looking at the sub-bandage pressure sensor data, they're kind of walking on those exposed toes. And so it kind of just reinforces that concept that they're walking on the exposed toes and they're also walking, more on that foot. They're bearing more weight on it. So, um, yeah, that was surprising. It was interesting that we were excited when we found that. So,
That probably means that there's a role in any given situation for either of the splint types.
yes, yeah, that was kind of the takeaway for us that, um, maybe if you have a 1-year-old Labrador that's like totally bananas, like you're gonna want for sure to have a toes in splint where their foot isn't touching the ground. We kind of hypothesized that maybe tactile input is the reason why they're more willing to bear weight if the toes are out. So if you're kind of taking that away by keeping the splint as the thing that's touching the ground, and it encourages the dog to bear less weight on the leg, that's probably good in most situations for most fracture configurations. Slowing them down and having less force going through the limb is going to benefit fracture healing. But conversely, if you're talking about a 2 kg mini poodle with an RU fracture that you're not fixing primarily, you're just going to manage with splinting, those dogs are already predisposed to a non-union. Maybe having their toes exposed a little bit and allowing that tactile input would encourage weight bearing. So it's just, we can't say one way or another what's right or wrong. And I think it's very dependent on the patient and the situation, and the fracture type and location and all of that. But it's just a good thing to keep in mind, really, when you're putting a splint on. We think about how far to extend splints proximally, or what materials to use or whatever else, but we should also probably think about how far it's going distally too.
So, Sarah, you talked about how your mentor has that long list of research questions. So, what are next steps for research?
Well, I don't know what else is on her list, but I think in the case of this project, um, there's a lot more to expand upon. We kept it simple and just looked at forelimbs. Somebody could do the same thing in hind limbs. Maybe there's less of a difference because they bear less weight on their hind limbs than they do their forelimbs. Um, it also, we had some limitations with small sample size, and really short duration of wear. We just put the splints on, acclimated them for a few minutes and collected data and then put the next one on. So having splints on for a few days or a few weeks could allow the dog to acclimate, and maybe that would negate the differences between the two splints if they've had them on longer. Um, yeah, I mean, I think that it would be interesting to continue looking at it. It's such a clinically relevant thing that kind of affects everyone. So I would love to see more people repeat it or do it in dogs with fractures. That could change things as well. So,
Well, it sounds like there's more work to be done.
yeah,
Always right.
always.
So, do you see a role for AI in this area of research?
I mean, I bet somebody has done it already, but I feel like AI would have a really good place in gait analysis. Like for any animal or people, it's, kind of a complicated thing, and I bet that that would be really beneficial in that area.
Yeah, I can definitely see that. I remember when I was a vet student, one of the coolest resident rounds that I saw was one of the residents did a gait analysis in Humboldt penguins at a local zoological institution. Yeah, yeah, it's the first thing that my mind jumped to. So super cool.
That's
How many
awesome.
species you can use it for.
Yeah.
And for those of you just joining us, we're discussing how exposed digits increase weight bearing and alter sub-bandage pressures in dogs with forelimb splints with our guest, Sarah.
Sarah, you talked earlier about your career as a certified veterinary technician, and now you're a final year veterinary student. How did, or maybe it didn't, how did any of that training help you write this article?
Yeah, it definitely did. I think having a lot of, like, relevant clinical experience just, like, dealing with bandages definitely helped, and, um, I'm comfortable placing them as well and making splints, so I placed all of the splints, and then I also have had a fair amount of, opportunities to get involved in research through vet school, and even before when I worked here as a tech, I would dabble in the resident projects and stuff, so all of that has kind of allowed me to get enough practice to be comfortable doing something. Obviously, I had a lot of support and a lot of questions for Dr. Gordon Evans, but I was able to do a lot of it, kind of myself, and that was really fun to have the training wheels taken off a little bit and um, get that practice. I really enjoy doing clinical research, so it was fun.
We look forward to seeing how your career progresses.
Me too. We'll see.
So, Sarah, this next part of questioning is going to be really important for our listeners. The first one is going to be from the veterinarian's perspective. So, what is one piece of information the veterinarian should know about how exposed digits increase weight bearing and alter sub-bandage pressures in dogs with forelimb splints?
Yeah, I think, kind of what we talked about before, just that this particular topic hasn't really been explored yet that we know of. And we think it just should be a conscious consideration when you're placing a splint, depending on the needs of your patient, their disposition or their fracture type and location. It should just be something that we think about, when we're placing a splint. Because it could have, based on our results of our study, it seems to have a relevant impact on how the animal walks and how much weight they're bearing. So it's just be something to think about.
And then on the other side of the relationship, what's one thing that clients should know about forelimb splints?
I mean, I think that it's just important to that owners realize how much impact they have on how their pet does with fractures or wounds. Anytime there's a bandage involved, the owner at home is with the pet and managing them for the vast majority of the time. And I think it's important to empower them to realize that they have a lot of impact on how their pet does, if they're being, really aware of the how the animal's doing and the state of the bandage. They can make or break the healing process, and so it's important for them to realize that they have a lot of power there. If they're being really, um, they're being careful to monitor closely, they can really help their dog do better. So, and that's kind of, the whole monitoring the digits thing, just because the digits are slightly more covered by the bandage doesn't mean we can't be aware of them. So,
Yeah, same for horses, right? It's
yeah.
and you have the three different types of clients: the compliant, the ones that are uh, completely non-compliant, and the ones that are over-compliant, right? Like, and then don't let the dog jump on the couch. Oh, I felt sorry for her. No, the horse. I remember as a resident, actually, I fixed an elbow fracture in a horse.
Oh,
Sent it home, and about 3 days later, after it went home, I got a video of the horse. She's doing great. She's turned out, galloping and bucking and running around. I was like, great,
yeah.
great. Looks good. Same, that's the same thing as box stall rest.
Yeah, I think we've all been there. I remember one little dog, he had like a tarsal fracture or something, and he came in a couple different times and we took the bandage off and like sand fell out of it. And they're like, "Oh yeah, he runs around down by the river." And it's like, "Okay, great. Okay, yeah, sounds good."
Well, thank you, Sarah. As we wind down, we like to ask a kind of a fun question. And what, for you, I'd like to know, what is your favorite animal fact?
I think it's super cool that whales used to be land animals. Like, and they have all these like vestigial structures that they have evidence of having walked on land before. Like, just thinking about that process and like how big they are and how much transformation they had to go through to do that, I just think it's super cool. I want to know what they looked like before.
You've had so many aquatic animal facts for that question. I love it. I learn something new every time. So thank you so much, Sarah. We appreciate you being here and sharing insights from your article with us today.
Yeah, thank you so much for having me. It was really fun to talk about. I'm excited to kind of disseminate the information. I think it's important for everyone.
Oh, definitely. Agreed. And to our listeners, you can read Sarah's article in JAVMA. I'm Sarah Wright with Lisa Fortier. Be on the lookout for next week's episode, and don't forget to leave us a rating and review on Apple Podcasts or whatever platform you listen to.